finding, how do you really know that and proving that? So that's what I want to teach you to do today. On slide 2, I feel like these are the keys to billing Medicare. Of course, we're going to focus on the Medicare Physician Fee Schedule database. Step aside a minute and just to remind you that we are going to talk just a little bit about MACRA, about the new payment methodologies coming for physicians. We are still going to need to understand the fee schedule database. A lot of what we're going to do for the next 5 years is still going to be based on this. And even after that, when we've got some new alternative payment models coming, there is still going to be a lot of our billing and coding is still going to be based on this. So we're not throwing this out the window. We planned this and we scheduled this presentation before MACRA was passed. But it's still going to be valid, and that's why we decided we'd throw in just a little information if we could about it, so just to help you know that it's out there and how it's going to change. So you're still going to need these resources on slide 2. So we've got things like the Medicare Internet-only manuals. There's really 3 that you're going to look at. One you're going to spend more time in than the others, and I've given you the web address there. You're probably going to spend more time in the claims processing manual than anywhere else, and I'm going to talk about that in a moment. And then, of course, the fee schedule database, and then the National Correct Coding Initiative. So I want to tell you just briefly about those other resources, and then, again, we'll jump in and spend the bulk of our time today talking about the Medicare Physician Fee Schedule database. On slide 3, just those Internet-only manuals, you've got the Benefit Policy Manual, which is where what happens is that Congress passes a law and says, this is what Medicare is going to cover, or this is what Medicare is going to do. And then it's sent to Health and Human Services, the Center for Medicare and Medicaid Services, and they make regulations out of that law. And this is where you're going to find that. So if Congress says, hey, we think that Medicare should cover this, well, then how that's going to be covered? What are the criteria for coverage? What are the age limits? What are the diagnosis limits? That kind of thing gets codified into the Benefit Policy Manual. So specifically, you would want to look at Chapter 15, and it would give you some of the information on covered medical and other health services. Now, the National Coverage Determinations Manual, you may already be somewhat familiar with. This is where the ultimate source for those coverage listings for lab services or for other services that have specific coverage determinations. And then that last one is the Medicare Claims Processing Manual. This is where Medicare, CMS, is giving directions to your local contractors on how they should pay certain claims. So information on how they can pay for critical care, information on what documentation to look for endoscopies, all kinds of virtually all the services you're going to perform, the information is going to be there. Now, specifically, you have to remember it is written to the contractor telling them how to process the claims. So you have to read it with that in mind. Now, you're going to look at this manual. You're specifically going to look at Chapter 12. There are a few other chapters you're going to look for, but when you're looking for physicians and non-physician practitioners, you're going to specifically look at Chapter 12, and Section 30 is where the correct coding policy comes in. There's a lot of other information there as well. For example, Section 100 would be teaching physician guidelines and how to deal with when you have residents and how to bill for those services.